Good morning! In Health Link today, new research reveals that reducing sugar for young children, especially during pregnancy and early childhood, could have long-term health benefits. A recent study, published in Science, suggests that cutting back on sugar in a child's first 1,000 days after conception might significantly reduce the risk of chronic diseases later in life. The study found that children with lower sugar intake early on had a 35% reduced risk of type 2 diabetes and a 20% lower chance of high blood pressure as adults. And, get this, the onset of these conditions was delayed by several years for kids with lower sugar intake in those early years. Researchers analyzed data from the UK's World War II-era sugar rationing, which ended in 1953. During rationing, sugar was strictly limited, and when it was lifted, sugar consumption doubled. Scientists used this natural experiment to see how higher sugar intake affected people's health. They found that children born right after rationing saw a faster increase in obesity, diabetes, and high blood pressure compared to those born during rationing. According to Dr. Mark Corkins, a pediatric specialist who reviewed the study, "We're hardwired to like sweet things from birth. Traditionally, we satisfied these cravings with fruits, but now refined sugars are everywhere in sweets, snacks, and even baby food." Corkins explains that when we eat more sugar, our bodies store it as fat, and this can have lasting health impacts. According to Dr. Mark Corkins, a pediatric specialist who reviewed the study, "We're hardwired to like sweet things from birth. Traditionally, we satisfied these cravings with fruits, but now refined sugars are everywhere in sweets, snacks, and even baby food." Corkins explains that when we eat more sugar, our bodies store it as fat, and this can have lasting health impacts. The U.S. dietary guidelines suggest that children over the age of 2 should limit added sugars to less than 10% of their daily calories. But many pregnant women and young children are consuming way more than that, sometimes triple the recommended amount. Experts say parents can help by modeling healthy habits, choosing water over sugary drinks, and keeping tempting sugary snacks out of the house. Researchers believe that with better awareness and healthier options, families can make these important changes and give kids a healthier future. With the holiday season just around the corner, it's a great time to remember small changes now can make a big difference later. For more tips and health news, stay tuned to our channel.